Hi everyone, welcome to this month's BodyWise movement tip anatomy portion. We're using a very cool app called See Anatomy. I'll show you the icon to look at the shoulder blade and the muscles that suspend the shoulder blade in position. So the first thing to notice here is that the shoulder blade is actually just floating on the rib cage. You can see, I'll give you a couple different angles here, that there is no bony stabilization of the shoulder blade. It pivots here with the front edge of the collarbone or outside edge of the collarbone, but that's not really what keeps the shoulder blade still so that we can use our arm. That stabilization happens with synergistic contraction of these different muscles that attach on the shoulder blade, and they stabilize the shoulder blade off of the base of the skull, the neck, the mid-back spine, lower part of the thoracic spine, and in the case of the latissimus dorsi, even our lower spine and sacrum, and also off of our rib cage. So when these muscles are firing in a balanced way, the shoulder blade is held in a nice neutral position, and you can see the shoulder blade has the socket for our shoulder joint there in green. And that way, the orientation of that socket where the arm bone sits is in a nice balanced neutral position. What happens is that we develop more tension, say, in our upper trap, which pulls the shoulder blade up, and the pec minor, which pulls the shoulder blade forward, so we can have tightness in our neck from stabilizing our shoulder blade off our neck. And potentially, if the pectoralis minor is short, these two muscles often work together, then our shoulders may be a little curled in as well. What we're doing in the exercise is firing this lower trapezius muscle and pulling the shoulder blade down and in, like that. There's a little bit more of an inward movement too with this that the app isn't showing. You can see it does pull it in there. It's subtle in the recording. And as we do that, what happens is that the shoulder blade is pulled back in towards the spine and helps lengthen this front muscle. Now, if you feel any tingling in your arm as you do the exercise or pulling, that can be a couple things, but if you get tingling or numbness, that's because the blood vessels that go down to our arm travel underneath this muscle. And when we're stretching this muscle, it can put some pressure on those nerves and blood vessels. It's not going to damage them because we're not going to stay in that position for a prolonged period of time. We're going to take a few breaths and then let our arm back down and rest. Okay, I hope that's helpful, and I'll see you next month. Bye-bye.